Welcome to the Healers Café, conversations on health and healing with Dr. Manon.
So welcome to the Healers Café, and today I have with me Anissa Young, and she is a Bowen therapist, a hypnotherapist, and a mind and soul coach. And let me see, what else can I tell you about her? I think, you know what, the rest, I'm just going to introduce you, Anissa, and all the way from New Zealand. And I would, I'd love to find out, well, the biggest curiosity I have is Bowen and hypnotherapy. But before we go there, could you share a little bit your journey into the healing arts in general? What brought you here? What brought you to what? How did it all happen for you?
Sure. So I'm Anissa. So first of all, I'm on the mid-north coast of New South Wales in Australia.
Oh, New South Wales. I'm sorry.
Wrong country. Okay. I've been a Bowen therapist for, I'm a newbie. I'm only been a Bowen therapist for just over a year. It feels like a lot longer because of the training and how long the training took during COVID. So I've been, practicing for now, nearly 3 years. So it feels like I've been on this journey for quite a while now. My fantastic teacher is Tina Price, and she's just a couple of hours down the road from me. And she, as soon as I met her, I knew it was the right thing for me. I was a teacher, a high school teacher of 20 years, and I was feeling flat and anxious about going to work and was hating life, hating reports, hating the kids, hating the admin. I was just hating everything. So I took some time off. This was all pre-COVID, of course, and I decided to go to Machu Picchu because that's what you do when you don't know what to do with your life. And I came back still very anxious about going back to work. So I went and saw my Bowen therapist because I had anxiety, because I was having headaches. I had a gallbladder issue at the time. And so I went and saw her, and she said to me, well, what are you going to do? Like, if you don't teach, like I've taught for 20 years, what else do you do? I'm an art teacher. So I'm not going to make my career as an artist. So I thought, I don't know, I'm going to do a course. I'm going to take 12 months leave. I'm just going to do a course. And she said, well, look into Bowen. Have a look at it. She said, it'd be right up your alley. You'd really love it. So I went, so that was it. I went and had a look, had Google online what I needed to do. Next thing, I've met my teacher, Tina. And as soon as I met her, I'm like, this is what I want to do. So, fast forward a little bit of time. And here I am in my own practice. I did my Bowen Cert 4. And then I decided that I wanted some more. I just wanted something else. I wanted more. So I was tossing up, do I do Reiki? Do I do hypnotherapy? They were both kind of on my radar, but I didn't know exactly what I wanted to do. So once again, I spoke to my friends. And one of my friends actually said, I'm doing a hypnotherapy course in like 3 weeks. Come and do it with me. I went, yeah, okay. So I looked into that. I spoke to the presenter, and once again, as soon as I don't know, I just have that feeling when you meet someone, especially as a teacher, as a facilitator. I have just a feel, and we just gelled, and she just seemed amazing. And I thought, well, let's do that as well. And since doing the both of those, I have also enrolled in doing my Reiki. I'll do that early next year. So that'll be another little, feather in the cap. Because I really love the whole mind, body, soul combination. And because I do coaching as well, and NLP, and I like to mix everything in all together. So a client might come into me, and before we do anything, we'll just do some breath work. Before we do anything. If a client comes into me, I've had clients come in, in the midst of a panic attack because they've forgotten their medication, and just getting here was enough. Clients that I've seen before, I'll say to them, we're going to do some hypnotherapy right now. Are you okay with that? and I'll put them straight into hypnotherapy to take the edge off that panic attack and to get them out of their funk. Mm-hmm. So the hypnotherapy and the Bowen therapy work so beautifully together because, I mean, I know Bowen therapy is designed to get you out of your fight and flight and back to your rest and relax and repair. But hypnotherapy on top of that, like, amplifies it because they're already resting their mind. They're already in relaxation mode, mind and body, before I even get them on the table. So even if I do a super short relaxation hypnotherapy session, I find that once they're on the table, they're already super relaxed. You don't have that little chit chat that some people like to do while they're on the table until they flip over and you do the neck and head. That's all gone, and they're nearly asleep before you've even done sort of the BRMs. So that's why I love, and you can feel it in their body as well, how relaxed they are. You know, you don't feel that tension, and you're not fighting with the tension, especially for someone that's highly anxious, and especially for kids as well.
Interesting. Yeah, no, it's fascinating because I like I was telling you earlier, but I was tempted at one point to try and mix the two because I felt the way I had learned Bowen therapy was very, mechanical in the sense of it's seen as a physical therapy. Many of the people are using it as a physical therapy. And I certainly did, when I started my journey with Ozzy and Elaine Wrench, that's who I learned from. But then all my background as a naturopathic doctor, I was like, I'm dealing with trauma. I'm dealing with, a lot more going on. And I love it. That's why I call it Bowen first, because I do Bowen. But it's the context of healing that I find important. So I merge the mind-body aspect into the work the way that I'm currently teaching Bowen therapy out here in Canada and the States. So I found a need to contextualize. And I think Tom Bowen was aware of this. Like, there's no way that he didn't see all of this. But I think that translators often, you translate from the lenses that you see the world. That's what we all do. So if we have a chiropractic background, we see it like that. If we have an osteopathic background, we see it that way. If we have massage therapy, I think you're always limited, not negatively, but you're limited by the eyes you look at the therapy. And that has the beauty of precision. But the other side of it is that if you look at things like you were looking for something else, it was the same for me. I feel like there's more to make this beautiful. It's like you can really expand on it, So yeah, very interesting. Similar path, not hypnotherapy per se that I've used. But so explain to me why hypnotherapy and how you've seen it gel so beautifully.
I think because my hypnotherapist teacher said, once you find your therapy that works for you, you don't need anything else. You don't need to look for, if hypnotherapy works for you, you do hypnotherapy. Bowen therapy works for you, you do Bowen therapy. If, chiropractic works for you, you go and see a chiropractor. And I sort of thought, well, but why aren't we mixing these? Like, one thing can work for you, 100% one thing can work for you. But what about if we did multiple things and we integrated them? How amazing would that be? And because you can do hypnotherapy, sitting, standing, laying, you can do, conversational hypnotherapy. I thought, well, why can't I combine the two together for relaxation, not only for relaxation, but to take people that are particularly, I saw it to start with just from the anxiety, stress level point of view, and because of COVID. Everyone was coming in stressed. Everyone was anxious.
Right.
And we were in between lockdowns a lot as well. We're in lockdown, out of lockdown. So I was seeing it with kids, particularly that, anxious about going back to school. Anxious, some people, their house is their safe place. For some people, it's a pure nightmare. So,
Right.
In and out of lockdown, I was seeing people that were coming in that were just anxious about life.
Yeah.
So I thought, well, if I do some hypnotherapy, it's going to take the edge off. They come out of hypnotherapy completely relaxed. They go into hypnotherapy on a level of 8 out of 10, 9 out of 10 stress levels. They come out at 3 or 4. So I thought, well, what if I then, coming out at 3 and 4 stress level, what if I then bumped it on with some Bowen as well? Because a lot of them, they're coming to see me because they've got a physical issue. They might not necessarily tell me they've got anxiety, or they might necessarily tell me that there's some emotional turbulence or some trauma that's been in their life, since they were 2. They're not going to tell me that straight away because I'm not a counsellor. But if I can recognise that it exists, and you can usually recognise when someone is quite flighty and quite anxious, and, I'm that person. So I'm busy, never stop. So if I know I can take the edge off myself from doing some hypnosis by doing some, even some breath work, some vagus exercises, any of those things that can take the edge off, I feel like, well, if I can show my clients how to do that, they can't do Bowen on themselves necessarily, but they can leave the room and they can go and do some breath work. They can do some introduction to hypnotherapy and put themselves into a light trance. They can do a vagus exercise and take the edge off. And I felt like that was where I needed to go.
Mm-hmm. And did you find that then, because everyone's experience with Bowen therapy is different. But I have found that, and maybe it's because of my, we attract certain people in our practice. So I've been doing, Bowen for 30 years now, and seeing lots of people, about 150 a week. Like, it's been a huge part of my practice and a huge part of my passion. But I found that the body work in the context, in a bigger context, not just here, we're going to fix your shoulder, but actually allowing for the journey to happen in a bigger way. A lot of traumas get released through the body, and people tap into the body as as if it holds on to the unconscious. And so it's because I've seen it over and over again. I've talked about this, and I've said to other Bowen therapists trained more on a physical structural level, well, do you have people releasing all their trauma and bringing this to surface, even like odors, tastes, all kinds of things coming up, and they are going, no, it's, I don't see that, right? So I'm curious, I'm assuming with hypnotherapy, when people are in a slightly trance level and therefore in already parasympathetic, this would happen more often, where they can release or tap into, fundamental issues that might be at the origin of some of the physical manifestations. Is that your experience, or?
Oh, definitely. So, and that's something that I am trying, I'm working even more on tapping into and helping the clients to understand, because half the time they don't understand that's
what's happening.
Be, and that could be what's happening, and that could be where, it could be grief, it could be trauma, it could be physical trauma, it could be emotional trauma, and it's trapped in the body. It's been there for a long time. They've had this ongoing injury. I had a client come to me last week and said, do you think because my wife died 12 months ago, do you think I'm harboring the trauma in my body? And I was so happy that he had made, yes, your wife died, that's so sad, but I was really happy that he'd made that connection, that it could be the trauma and the grief that's actually he's feeling and harboring, physically. So I definitely, I try and tell my clients that as much as possible. And a lot of clients acknowledge that. And a lot of clients, particularly, I find it particularly with my fibromyalgia clients as well.
Yes.
Because there's such a huge link between fibromyalgia and trauma of the body, whether it's, you know, physical trauma or emotional trauma. And I find they are the most sensitive as well to feeling those effects. I think because we go so slowly with them, you know, we do longer waits with them, we're even lighter to the touch. I feel like they definitely feel that. They feel that release. And quite often they will feel the sensations. They will hear things. They will have flashbacks. They will see colours. There's definitely more of that mind-body connection that I've found, probably more so than anybody else. There's obviously sensitive clients that do, but quite often it's those fibro clients that really have a real connection between the mind, body, and that release of the trauma.
Hi, I'm Dr. Manon Bolliger, and I wanted to take a moment to thank you for watching these podcasts. If you haven't subscribed, please do. Also, feel free to leave comments and like it. This way, more people get to find out about this work and about other choices for health. So I think it's really important that we all share this information. I have a free gift to you. It's a 7-sequence email that has tips for every day, and it's a little insight about how to live your life when it comes to health. And it's very much built on how I managed to overcome stage 4 cancer and what it took. So I would love you to have this, and thank you once again for listening to these podcasts. Yeah, no, I think, and you know, it's funny, I agree with you completely. And I think with fibromyalgia, because it was such a misunderstood clinical diagnosis for so long, and they were told it's all in their head, which of course we know it's not. But the thing is, I think it did encourage more people to be open who have it, to maybe there's more going on. And it's not that, oh, the head is the cause. No, is that we are truly mind body, right? There is no way around it. You know, so yeah, I've often wondered why that is, but I think, yeah, given that you've experienced the similar
yeah, and I think sorry, I also think that because they have been through, quite often, I mean, here in Australia, there's still that, well, we haven't found anything else wrong with you, so therefore you must have fibromyalgia. You know, they do all of the other tests, they do all of the other scans, they look for everything else. It's kind of like IBS. Well, if you don't have Crohn's and you don't have diverticulitis, then you just IBS. You can't find anything else. So I find that it's the same sort of thing with fibro, and because they've been through so many different scans and so many different steps, and there's so many other things that they've been tested for, that they're really looking for some form of relief. Yep. They're looking for anything, anywhere that they can get. So by the time that, and quite often, you know, I don't know how you find it, but I find that quite often they come to me and they're like, you're my last hope. I've been to see everybody else. I've done so many other things. And I still find in Australia, even though Tom Bowen was Australian, and it was, you know, done in Australia, it's been done in Australia for a long time, there's still people I talk to daily that don't know what Bowen therapy is.
I know.
I know how beneficial it is, and have never heard of it before. And I get people hang up on me because they just want a massage. And when you do the description of, well, it is hands-on, but it's not just a massage, it's a massage unlike anything that you would imagine or that you recognize, some people are frightened of that.
Yeah,
and in the community. I mean, not my clients are coming back and they're loving it. And they're loving the combination of everything else that we do. But I find in the greater sense of the community, there's still a little bit of a stigmatism about, I don't know what this is, so therefore it must be a bit woo-woo.
Yeah. I mean, that's going to take, I'm sure it's going to take time, you know, but those who have been healed through it, yeah, and there's no,
exactly, there is,
you know.
Yeah, exactly. And especially the clients that keep coming back, as long as they're coming back, then you know you're doing the right thing for them.
Yeah, absolutely. And I was going to say coming back, because I wanted to just address that, because that is also one of those things that people often misunderstand, is that at least in my experience with Bowen therapy, we're not allowed to use the word cure, so I won't use it, but we can bring a person in a fairly short time to complete resolution of what they came in with. And so when we say we have clients that love coming back, it's because, at least that's what I found, because life happens and now they have a ski injury, or now they have a snowboard injury, or now they have something else. Or some of them, it's like the feeling left in their body connects them so much to themselves and to really being embodied that they want that. And so I've been asking, you know, like, you have no more pain. And at the beginning of my practice, I was so busy that I said, no, I only see people in pain. You know, if you don't have pain, I can't help you. And then I thought, this is such a ridiculous position. So I changed. I said, yes, sure, we can do other release work, something else, because well, I hadn't experienced it on that level, right? I was just fixing things until I got into the deeper work. I had no clue that it could help so profoundly, so many levels of what's in our unconscious, right? You know,
exactly. And it's that tune up that our body needs, you know, our after, you know, 3 or 4 months, depending on your age, depending on your activities that you do, that you need that tune up. Your body has gotten out of its alignment. You know, I have clients that, you know, really work hard in the gym and they come back for their just under 3 months, because I have a few clients that say if I hit the 3 months, I do an injury. So they're coming back for that prevention. You know, they're certainly coming back because they can feel that little twinge of the sciatica, you know, might be coming back. They just, that first little sign of it, they're straight in and up on the table, because they know that it's going to calm everything down so that they can go about their CrossFit or their weights or whatever it is that they're doing to prevent the injury from coming. So that's what I love about it as well. It's not just come and see me when you're broken, come and see me when something hurts. It is come and see me to prevent anything from happening, to keep that alignment and to keep everything all in its place so that you can keep going and be at your optimal, you know, you can be at your prime.
Exactly. I was going to ask you, of your time in practice so far, has there been, without names, obviously, since we have to protect that and protect any medical information, but what has surprised you the most? What story or patient or turnaround?
Look, I think that the biggest thing that has actually surprised me was during lockdown. I had on our Australian Bowen therapist support page, we had Bowen therapists saying, has anyone tried distance Bowen before? Mm-hmm. And most people like, no, how do you do that? How do you even do that? And I sort of had a bit of a read of the feed, and I thought, well, I'm going to give this a try. Mm-hmm. I'm going to try this. And I think the biggest surprise that I had was that it was just as effective via distance, via Zoom, via you and me talking here, and then you were going lying down, and then me practicing on my pillow person or on my teddy bear in my clinic and doing all the moves as if I would normally do them. And I was having clients saying to me, oh, I've got a really cold left foot. And I've literally just lifted the blanket on their left foot. Or I've got tingles in my kneecap and I've just hit the lat. You know, so I found that, and I wasn't telling them what I was doing. And I actually switched my camera off once they got on the bed. So we were just having audio.
Mm-hmm.
So they couldn't see what I was doing, but yet they were still having sensations. Some of those clients, 2 of which were my 2 fibromyalgia clients, I did 4 trials. So I did 4 sessions. I did 4 clients with 3 sessions each over the time, because I wanted to see, A, how it would work in the first instance, but I also wanted to see what the reactions were afterwards and what the healing and what their body felt afterwards as well. And all of them had exactly the same sensations and exactly the same recovery and exactly the same everything as if they had been in the clinic. So that led me to think, well, how much of it is purely our intention? You know, how much of it is how specific and how, you know, how we hold our hands and how much pressure and how much we do that in the exact precise spot, you know, on 1 centimetre above or 1 centimetre below, and how much of it is purely the client's belief in us and how much of that is energetic work. Mm-hmm. So I'm still toying with that. I'm still questioning that. And that's why I think even more so that I believe that mind-body connection and that is huge, is beyond, you know, beyond some of our understanding. And that's big in the sense of I was getting clients that were having the same sort of body ache after a session the next day as if they came into the clinic. I was having clients that were saying, my hip actually doesn't hurt. How does that work? And we were both kind of looking at each other going, I don't know. I don't know how that works, but tick it does. I mean, I do definitely think it's not something that is for everybody. Mm-hmm. And the people that I obviously trialed at clients and friends and people that have been almost like my guinea pigs since my logbook hours when I first started. So there were people that trusted me and that I trust them. Mm-hmm. It's certainly not something that I'm going to get my first client to say, yeah, let's do some distance Bowen. But I was pleasantly surprised, completely surprised at the reaction. So without any hands-on.
Yeah.
I don't know how it works, but it does.
But I think that's, you know, it's beautiful to try. Like that's what, you know, it takes, we need to be open, because the more we understand, the more we realize how much we don't understand everything, you know. And I think it really comes to question the importance of understanding the healing relationship in the first place. And in one of my books, A Healer in Every Household, I talk about placebo, nocebo, and also all of its negative connotations. That really, it's based on a pharmacological model, but truly healing, it requires what I decided to call the positivo effect. It's the desire, first of all, that both people are willing to work together, that there's a level of trust, and that they really want to heal. And then you're like one's body, everyone's body is programmed to heal. It just wants to heal. So we may not understand all parts. Like, you know, to some people who are used to heavy duty work, And then they get a Bowen therapy session and they go, what did you do? You didn't touch me and you're out of the room half the time. And like, give me my money back. You didn't do anything, and then wait till they get better. And then like, whoa, what happened? So that's like, that takes also a leap of logic and trust, because like, why is that working? Now, with all the information on fascia, we actually understand why the breaks make sense. And we understand a lot more, right? And understanding meridian lines and fascial lines. And it's like, oh, okay. Now there's science kind of that has come to explain what really seemed like a peculiar phenomena, right? So if we project forward, I think it's the same thing. What we don't understand about distance healing is becoming more and more, we'll have the reasons, we'll have the understanding. It's just that it's not yet there, but you can't deny reality, so.
Yeah, exactly. And that's the thing that blows my mind, is the more I do, not only just the Bowen on its own, the Bowen via distance, the Bowen with the hypnotherapy, the Bowen with some NLP, once you flip, and also once you can flip the switch of the negative to the positive. I get clients in all the time, and the first thing they say is, I can barely walk. And I flip it and go, but you're better than last week. As soon as you can get them to acknowledge, and instead of looking at the negative all the time, as soon as you can get them to look at that positive, and instead of saying, oh, I'm aching, I need to have, I need some medication before I can even get out of bed in the morning. If you can get them to have their own little mantra that is, well, today I'm feeling stronger and fitter than I was yesterday. And even if they're actually physically not, the more that they're going to say that, the more they're going to believe it. And, positivity breeds positivity, the same way that negativity breeds negativity. So if you can also get clients to flip that switch, I find I have a faster reaction rate as well, because they're mentally feeling like they're better, even though they're actually physically not there yet. I think that's that mind-body, as well, that connection that is so important, because, we all have clients I have clients and I have friends that say to me, well, the Bowen didn't work for me. The Bowen didn't work for me. And I have people that will ring up and say, I want a remedial massage. And I say, well, that's not me. I'm not. I do Bowen therapy. If you had Bowen therapy before, I know that didn't work for me. And I often say to them, yeah, but you haven't been to me. Because I also think there is that connection, there's a connection between client and between practitioner. But not only that, there is that belief that you've got to have in your head, and there is that positivity that I am going to get better. And some people just don't feel like they're going to get better, and there's always something wrong with them. Right. I have a friend and she always has something wrong with her. Yeah. And I've done Bowen therapy on her in my very early days, but because she won't get over, I say you can't get over yourself. As soon as you can get over yourself, that helps you. It's going to help you mentally, but it's also going to help you physically. Yeah. And I think too, like you're alluding to, but people have misconceptions about things that keep them also limited. Like, well, it can't be another way because, oh, it only works if you push really hard, or if you, and all of that. But listen, I'm looking at our time and we're like, it's over. Our conversation must come to an end. But I just want to say thank you so much for, I love the sharing of enthusiasm for that. There is hope for people, and also talking about Bowen therapy, very dear to my heart. And just being open as therapists to see what comes to us, and being curious, without curiosity, nothing changes. So definitely. Yeah. It was lovely to virtually meet you. Yeah, likewise. And thank you for being here. Thank you so much for having me.
Thank you for joining us at the Healers Café with Dr. Manon. For more information, go to drmanonbolliger.com.